Hi, this is Dr. Nina Pacomio. I'm a psychiatrist, and now we're going to talk about what happens if you have some symptoms that require you to go to a psychiatrist. Many people are very scared of us. They think that we're going to just drug them and, give them a whole bunch of medication for you to take, and it's not always that case. Actually, it depends on what type of psychiatrist you're reaching to. And this is the video, and this is what I'm going to talk about. First of all, in different countries, you have different stigmas about, getting help. Some countries are more like the society is more easy to understand when you have some problems with your thoughts or symptoms of your mind, like when you feel anxious or when you feel like your heart, is beating very fast and maybe you're having not a heart attack, but, an anxiety attack, or when you're getting depressed and you feel like there's no way out, or when you have insomnia and you can't sleep, or you sleep but you wake up in the middle of the night like many times and you can't fall into sleep again, so you have a very bad sleeping habit. So those are examples that might have to get you into a therapy with a psychiatrist. So what's with psychiatry? Well, we are doctors. We studied medicine, and afterwards we decided to study psychiatry, which is a specialty of medicine. Many countries have a very pharmacological, like way of seeing psychiatry. Some psychiatrists we take that, and some others we also, broad our studies into different fields, more like an holistic, kind of way, which makes you take less medication and uses another tools from psychology, mindfulness, relaxation, and many, many different areas from Occidental and Oriental, cultures. So you want to, if you need to go to a psychiatrist, you want to check what type of psychiatry you're, gonna ask an appointment. If you ask an appointment with a psychiatrist that is not into all the holistic, areas, then you might be in a therapy with a psychiatry maybe for 20, 30 minutes or a little more maybe. And you might have to take two or three different medications. And probably they would, ask you to go to a psychologist as well, which is good, to get into a psychologist, into the therapy. So you might have to see a psychiatrist and a psychologist at the same time. If you choose to, get a session with a psychiatrist, which, are in the holistic area, which is like my example. For example, I do those type of therapies. Then we sometimes, ask the patient to get into a therapy, with a psychologist, and some others, depending on the symptoms, we have longer sessions and we approach, the psychotherapy ourselves, and we use uh, very low doses of medication or non-medication. So you have to think about what type of psychiatrist, but this is not like a regular, society knowledge. Like everybody thinks that we're the same and we're not. We kind of, not only we specialize on, subjects, like I specialize on depression, bipolar, symptoms, stress, burnout, post-traumatic stress and anxiety. And there are some other psychiatrists which, they like to treat, maybe substance abuse or anorexic patients, and patients which have food disorders and overweight. So you don't have like a regular specialty, like subspecialty like traumatologists, which are like like arm traumatologist or a hand traumatologist. But in psychiatry, you have a psychiatrist that can do anything You like all of the things, or specialize in different areas. You want to choose whichever you feel comfortable. As another video that I just I posted on my YouTube, like on the Georgina, or in Terapia GR, you can see that, or in my LinkedIn as well. There are many psychologists, and they have different techniques. While in psychiatry, we don't have different techniques, we have different approaches. So what you want to know is which kind of approach do you use. If you use a psychopharmacological approach, or if you use a more holistic approach, and then you get forward and you ask for an appointment. What's going to happen is something similar as what I told you in other videos, which is that it depends on how you feel with the person when you're in a present or in an online therapy, and it might feel okay, and you might feel safe, or you might feel comfortable with the person, which is the signal that you can move forward with therapy with that person. But if you feel uncomfortable in any ways, or you relate this person to other people that you know that might have hurt you in the past, then it's not going to work, because the relationship between a psychologist and a psychiatrist with the patient is based on trust, and it's based on the truth, and telling the truth to the person that you is treating you. So if you don't have the comfort and the relax, stage in order for you to be honest, then the therapy is not going to work out for you, and you're going to get worse, and you're going to spend a lot of money. So, my recommendation is, if somebody tells you, if a doctor, a regular doctor, a psychologist, or people from the mental health area tells you that you need to go to a psychiatrist, then it's very important that you get an appointment with a psychiatrist as soon as possible. It depends. If it's an emergency, then they're gonna get it for you, or the approach in the hospital system is going to get it for you. But if it's not an emergency, then you can handle it yourself with the timing that you have. And you have to take into account these little details that I talked to you about the type of approach that the psychiatry would have. You can check it on the website. You can check it, maybe if you know somebody that has have therapy with that person, and if they can recommend it to you. But either way, if everybody talks like, if you get like the best of the world, or everybody talks like brilliant things about this therapist, you might not be comfortable with it, even though everybody's recommended to you, because there are some unconscious things that might relate you, like expressions, or the way they look, the way they talk, the way they talk to you, and might not make you feel like comfortable. So you just have to trust your guts and your instinct that I didn't like the way this went, and go for another therapist. We're very it's not a personal thing for therapists not to be required a second interview with the patient. Actually, we already know that it is studied, in psychology, like transference, countertransference. It's like, we know that sometimes the therapist doesn't feel comfortable with the patient, and sometimes the patient does not feel comfortable with the therapist. And so the therapeutic, space that has to be um, in order for you to get better, it's not happening. So it's not gonna work out. Sometimes the therapist already can detect it, and they tell you I recommend you to follow that, or just make an appointment with a different one, because maybe it's not the field that therapist is working, or maybe it's not the subject, the patient that it's reaching out is not has some symptoms that the doctor cannot, is not able to help. And that doesn't mean it's not that he's not or she's not a good therapist. It means that uh, the therapist knows the limits, and it's pointing out for you, not that he's limited in order for you to get better, but that he's not the one for you and for your therapy. And that can come the other way around, like you don't feel comfortable even though you thought, like, you felt that the subject, the psychiatrist was a really good one, but you don't feel comfortable with it. And so it's not going to work out. If you don't feel comfortable, then, the therapy cannot start. You're going to lose time. You're going to lose money. I mean, the doctor is going to lose, time. Everybody's going to get frustrated. So, that's why, like, that's the reason why I'm like making this video, and I hope it helps you, or it helps some other person that is going to have to need to get into contact with mental health professional like a psychiatrist. We are very used to people saying, I'm afraid of you. I hope I never need you. And it's not that a big of a deal. Actually, many people nowadays, they have insomnia, and the insomnium is one of our specialties. It's not, you don't need to go to a neurologist or go to any other type of doctor. Like, we solve that because it's in our field. So even if you have some insomnium, you might need a psychiatrist. So we can teach you some techniques, and we can if it's required, give you some medication for a short amount of time in order for you to be able to sort out, that problem with the sleeping disorder. And at the same time, like a lot of the sleeping disorders is related to stress. I'd made some videos like in my web that, deal how to handle stress. And, I'm also, like a private therapist. So, if you have insomnia problems, you might need to handle, an approach of how to handle stress besides the insomnia. So if you learn technique of how to handle stress, which is our field, like psychiatrists handle stress as one of our specialties, plus anxiety and many of others. It's not only schizophrenia or paranoid, symptoms. Like, we handle a lot of people that have neurotic, personality, but have some symptoms that are, disrupting their regular life. So, if you have those things, then you might, be enriched, and, you might be better, get better if you get a psychiatrist appoint. Just, take into account that maybe it might, take you a while to get the perfect psychiatrist for you. As I said, in other videos, like, to get a perfect, psychologist for you, it might take a few sessions with different ones. Be patient and get the help you need. Don't be scared, of us. We're not gonna, we're not prisoners. We're not gonna, or police, officers. We're just doctors who want to help people. And in some cases, the person has very acute symptoms and they really need help, acute help, and emergency. So we have to, help them in hospitals. But like most and the majority of occasions, it's just regular people that have, grief and have many, issues with emotional traumas and, things like that, that we can help in daily basis, and some with very few medication or non-medication, or some others with very few doses of medication. And so go ahead and just, request an appointment with whomever you might think you will be comfortable about, and start to, break down the taboo or the idea of, okay, I'm reaching a psychiatrist, and I'm going to a shrink, I might be going crazy. Like, it's not like that. In another video, I'm going to explain, some of the things, um, that make us, sometimes lose our, central line of balance and health, mental health. That's for another video that I'm going to explain. So I hope, it serves you or somebody else that you know. If it does, just forward it. Until next video, good luck. Bye bye.